Welcome to the ESRD QIP Proposed Rule and Preview Period webinar for calendar year 2027. For today's speakers, I will be presenting. My name is Alyssa Kapke, and I am the ESRD Quality Program Support Project Director from Arbor Research Collaborative for Health. And we also have Golden Horton, who will be presenting. She is from the ESRD QIP. She's the program lead and the Center for Clinical Standards and Quality for the Centers of Medicare and Medicaid Services. For today's agenda, we do have a packed agenda today. We will be covering the calendar year 2027 ESRD QIP proposed rule updates for the rule that was just recently released. Then we will cover the process for submitting comments. We will pause for a Q&A session for the proposed rule. And then we will shift over to the ESRD QIP preview period and go over the user interface and the payment year 2027 ESRD QIP reports, go over how to submit preview period inquiries, and then end the session with the upcoming ESRD QIP reporting deadlines and have a Q&A session. We encourage you to submit questions throughout today's presentation, and to do so, you can just click on the Q&A, which you'll see at the top of your screen, and click on Ask a Question. And then you can just go ahead and type your question in the box on the right-hand side of your screen. Now, if you do not see the Q&A at the top of your screen, you can use the chat option. We will monitor both throughout today's presentation. Just a few housekeeping items. All participants will be muted. And as I mentioned, we will be monitoring the Q&A feature throughout the session. And you can ask questions for our presenters. And we will be answering some of those throughout the presentation, as well as when we pause for Q&A after both the preview or the proposed rule session and the preview period session. If you do experience any technical challenges, please use the chat feature to request support. And as always, you can contact us using our email address, which we list here if you're encountering issues and can't use the chat function. I just want to go over the disclaimer. I won't read this out loud, but please take a moment to review. All right, so the purpose of today's webinar is first to discuss details of the calendar year 2027 ESRD prospective payment system proposed rule that pertain directly to the ESRD Quality Incentive Program. We'll also describe steps that the facility should take during the ESRD QIP payment year 2027 preview period to review reports and also to submit inquiries. Attendees will be able to recognize the statutory and legislative components for the ESRD QIP, understand the proposals in the calendar year 2027 ESRD PPS proposed rule pertaining to the ESRD QIP program, review the steps required to submit a comment, and access resources for the ESRD QIP payment year 2027 preview period. Some information about the proposed rule. Because CMS must comply with the Administrative Procedures Act, we are not able to provide additional information, clarification, or guidance related to the proposed rule. We encourage stakeholders to submit comments or questions through the formal comment submission process, as we will be describing in today's webinar. Here we're just showing some acronyms and abbreviations that you will see throughout today's presentation. And with that, I will hand over the presentation to Golden.
Thank you for joining us today. I hope you find the information shared during today's call helpful and informational. First, we will review the ESRD QIP legislative drivers and statutory foundations. Next slide. The ESRD QIP is a CMS program established through the Medicare Improvements for Patients and Providers Act of 2008, also known as MIPA. Its primary goal is to provide or promote high-quality care for patients with ESRD by linking payment to performance. Facilities that fail to meet the minimum total performance score will receive up to a 2% reduction in Medicare payments. The Protecting Access to Medicare Act of 2014 amended the Social Security Act by adding Section 1881. This addition requires that the ESRD QIP include outcome-based measures for conditions treated with oral-only medications as feasible. Next slide. The MIPA specifies that the ESRD QIP measures should include measures related to anemia management, dialysis adequacy, patient satisfaction, and beginning in 2016, to the extent feasible, measures on iron management, bone mineral metabolism, and vascular access, including a measure maximizing the placement of arterial venous fistula. Additionally, the ESRD QIP must establish performance standards for each measure, specify the performance period for each payment year, develop a methodology for calculating the total performance score, apply a payment reduction percentage, and publicly report facility-level results. Next slide. In today's presentation, we will discuss the proposals for the ESRD QIP that are published in the calendar year 2027 ESRD PPS proposed rule. Please note that the information given is meant as an informal reference and not official CMS guidance. We encourage you to refer to the proposed rule located in the Federal Register. We have provided a link to the proposed rule on this slide. Next slide, please. Next, I will provide a summary of the proposals in the calendar year 2027 proposed rule related to the ESRD QIP. Next slide. The calendar year 2027 ESRD PPS proposed rule includes proposals covering payment year 2029. CMS has undertaken efforts to review the existing measures set to ensure continued clinical impact and effectiveness of the measures on facility performance. Therefore, beginning in payment year 2029, we are proposing to replace the hypercalcemia reporting measure with the facility-level percentage of chronic hyperphosphatemia in dialysis patients clinical measure. Additionally, we are proposing to remove the COVID-19 healthcare personnel vaccination measure and MedRec reporting measure, a change that effectively would remove the reporting measure domain. As a result of these changes, we are proposing corresponding updates to the domain weights and individual measure weights in the care coordination domain and clinical care domain. Finally, we are proposing to update the NHSN bloodstream infection clinical measure, which I will cover in greater detail later in this presentation. This proposed rule also requests public comment on inclusion of the dialysis facility discussion of patient life goals, also known as DPALS, survey in the ESRD QIP measure set in a future payment year. Next slide. First, I will discuss the proposal to replace the hypercalcemia reporting measure with the hyperphosphatemia clinical measure. Next slide. Beginning in payment year 2029, we are proposing two changes related to the hypercalcemia measure. First, we will remove the hypercalcemia reporting measure. Second, we would adopt a new clinical measure, the facility-level percentage of chronic hyperphosphatemia in dialysis patients, referred to throughout as hyperphosphatemia. The rationale for this substitution is twofold. First, the hypercalcemia reporting measure has demonstrated diminished clinical utility as a reporting measure. Second, CMS is statutorily required to include measures of bone mineral metabolism in the ESRD QIP. The removal of the hypercalcemia measure proceeds under removal factor 5, which applies when a measure more strongly associated with desired patient outcomes becomes available. The new hyperphosphatemia clinical measure constitutes that stronger, more outcome-oriented replacement. Next slide. Next, we have the proposal to remove the COVID-19 vaccination coverage among healthcare personnel reporting measure. Next slide. CMS is proposing to remove the COVID-19 vaccination measure from the ESRD QIP measure set beginning with payment year 2029. The removal of this measure falls under removal factor 3, which applies when a measure no longer aligns with current clinical guidelines or practices. Next slide. The third measure we are proposing to remove beginning in payment year 2029 is the Medication Reconciliation or MedRec reporting measure. Next slide. The removal of the MedRec measure falls under removal factor 8, which is associated with the measure outweighing the benefit of its continued use in the program. Next slide, please. Next, I will cover the proposals to update the NHSN bloodstream infection clinical measure. Next slide. Beginning in payment year 2029, we are proposing to update the NHSN BSI clinical measure in two ways. First, by replacing the 2014 baseline with the most recently available 2023 national baseline data. And second, by revising the risk adjustment methodology. Adopting the 2023 national baseline allows facilities to benchmark against more recent national data, producing more accurate and equitable comparisons. It is important to note that the standardized infection ratios calculated under the 2023 baseline are not directly comparable to those calculated under the 2014 baseline, as each relies on a distinct reference data set and risk adjustment model. If you want to get into the details about the risk adjustment, we are revising the risk adjustment model to incorporate additionally facility-level characteristics, including patient access type, the facility hospital affiliation, and number of dialysis stations. These characteristics were identified as significant predictors of BSI risk based on data reported to NHSN. Next slide, please. Next, we have the proposal to remove the reporting measure domain and reweight the care coordination and clinical care domains. Next slide. Because we are proposing to remove all three reporting measures, including hypercalcemia, COVID-19 healthcare personnel vaccination, and MedRec, we are proposing to drop the reporting measure domain. The 10% weight that was previously assigned to the reporting measure domain will be redistributed to the care coordination and clinical care measure domains. These revised weights, which I will show on the next slide, prioritize clinical impactful measures, reinforce national priorities such as increasing kidney transplants, and ensure appropriate weighting of newly adopted outcome measures, while maintaining stability and continuity within the ESRD QIP measure set. Next slide, please. This slide presents the proposed individual measure and domain weights for payment year 2029. Shown in the third column of the table. For comparison, the second column displays the finalized weights for payment year 2028. We're proposing to increase the care coordination domain weight to 35% and the clinical care measure domain weight to 40%. The new hyperphosphatemia clinical measure will fall under the clinical care domain, with a proposed measure weight of 7% of the TPS. The remaining measures in this domain, including the dialysis adequacy topic measure, the long-term catheter rate, and the standardized transfusion ratio, will be weighted equally at 11% of the TPS. In the care coordination domain, we're proposing to increase the PPPW clinical measure to 9%, consistent with our continued priority of increasing kidney transplantation. The SHR and SRR measures would each be weighted at 9% of the TPS, and clinical depression would be weighted at 7%. We are not proposing any changes to the patient and family engagement domain weight, which includes the ICH CAPS clinical measure at 15% of the TPS. Similarly, no changes are proposed for the safety domain, which includes the NHSN BSI measure at 10% of the TPS. Next slide, please. In addition to the proposed measure changes I've just described, this proposed rule also includes a request for information, or RFI, on a potential future addition to the ESRD QIP measure set. The dialysis facility discussion of patient life goals, patient reported outcome performance measure, referred to as DPALs. It's important to note that this is a request for information only. CMS is not proposing to adopt this measure at this time. Rather, CMS is soliciting public comment to help inform potential future rulemaking. The DPALs measure would evaluate patient satisfaction with how well the dialysis care team discusses life goals with patients and to the extent which those goals are incorporated into treatment planning. The underlying survey includes several patient-reported items, and the measure would be constructed at the facility level, assessing the percentage of eligible patients who's completed at least one scorable survey item. This measure reflects a broader effort to bring more patient-centered quality of life measures into the ESRD QIP, moving beyond purely clinical or reporting-based measures. CMS is seeking stakeholder feedback on the measure's design, implementation considerations, and appropriateness for inclusion in payment-driven programs before considering it for future rulemaking. Next slide, please. Next, I will cover the proposed payment year 2029 payment reduction scale. Next slide. For payment year 2029, we estimate that the QIP eligible facilities must meet or exceed a minimum total performance score of 51 points to avoid payment reduction. For every 10 points below the minimum TPS, the payment reduction increases by 0.5%, with a maximum payment reduction of 2% for those facilities receiving a TPS between 0 and 20 points. Next slide, please. On this slide, we are displaying the link to the proposed rule in the Federal Register, as well as the link to the fact sheet summarizing the proposals in this rule. Please note that we will be posting these slides on eqrs.cms.gov on our events page, so we encourage you to download them to access these links. Next slide, please. Next, I will cover the comment period process, including how to submit a comment. Next slide. First, I will give an overview of the public's role in the rulemaking process. CMS writes, then publish the proposed rule in the Federal Register. Once the rule is published, we have a 60-day comment period. For this rule, the comment period ends on August 24th. After the period closes, CMS reviews all comments and addresses them as appropriate. The responses to the comments and any changes deemed necessary after review of the comments are published in the final rule. Once the final rule is displayed in the Federal Register, it becomes regulation. Next slide, please. As I mentioned, comments must be received by August 24th. CMS encourages you to submit electronic comments using the link provided in these slides or in the Federal Register, but you may also submit comments by regular mail, express mail, or overnight mail using the address designated in the rule. CMS will carefully review each comment, and responses will be published in the final rule. Next slide, please. Here's a screenshot of what you will see when you navigate to the proposed rule in the Federal Register. From here, you can scroll down the page to review the rule or select the PDF option to download the rule. Next slide. To submit an electronic comment, click the green box that says Submit a Public Comment. Next slide. You then need to enter your comment in the comment field, and if you would like to add an attachment, you may select the Add a File option, which is in the green box on the bottom of the screen. Next slide. Once you have entered all of your information, select that I read and understand the statement above box. Then select the green Submit Comment button on the bottom of your screen. Next slide. On this slide, we have provided you with some resources pertaining to the ESRD QIP. Additionally, you may submit questions to your question and answer tool using the link on the bottom of this slide. Next slide, please. Now we will go over the questions we've received during the presentation so far. As a reminder, if you wish to submit a question, please click on the Q&A on the top of your screen to submit your question.
Thank you, Golden. So we do have a few questions that I can ask you, Golden. First, this one's related to the proposal to remove the COVID-19 healthcare personnel vaccination reporting measure. Should the facilities continue to report their monthly vaccination data in the NHSN system?
Hi, Alyssa. Great question. So yes, CMS is still requiring facilities to report COVID-19 HCP vaccination data in the NHSN for calendar year 2026, and these data will be used to determine your payment year 2028 COVID-19 HCP vaccination reporting measure score. If the proposal to remove this measure is finalized, this will be effective starting in calendar year 2027. And as a reminder, submission deadlines are posted on our eqrs.cms.gov website.
Okay, thanks, Golden. A similar question about the medication reconciliation measure, where facilities are currently submitting monthly data in EQRS. Should they continue to submit that data as well?
Yes, facilities must continue to report the MedRec data in EQRS for calendar year 2026. However, again, if CMS finalizes its proposal to remove the MedRec reporting measure, facilities will no longer be required to report this data in EQRS beginning in calendar year 2027. And also, EQRS clinical measure reporting deadlines are also posted on our eqrs.cms.gov website.
All right, and then another question about medication reconciliation. Will CMS be replacing that measure with a similar measure in the future?
Great question. So CMS remains committed to the ongoing evaluation of the ESRD QIP measure set. We're continuously assessing both existing and potential new measures to ensure the quality of care can be delivered to dialysis patients is effectively monitored and improved. So any measure that replaces the existing MedRec measure would be identified in a future proposed rule to ensure stakeholder comments will be obtained and used in the decision to add it to the ESRD QIP measure set.
Great, thank you. I am seeing some questions about the new hyperphosphatemia measure. We would ask that you submit those to the CCSQ ServiceNow help desk. I think we've got a link in the chat section and on the slides as well. We want to make sure we can give you the detailed response and have it written out for you. But then we do have one question about why CMS is proposing to replace the hypercalcemia reporting measure with this facility level percentage of the chronic hyperphosphatemia in dialysis patients clinical measure.
Yeah, this is a great question. The hypercalcemia reporting measure only requires facilities to report calcium values. The new hyperphosphatemia clinical measure would encourage facilities to identify patients with chronically elevated phosphorus levels who would benefit from additional interventions, such as diet counseling, phosphorus binding medications, or adjustments of dialysis prescriptions. Adoption of the hyperphosphatemia clinical measure will help drive decreases in cardiovascular complications, hospitalizations, and overall mortality by incentivizing these additional interventions. So hopefully that was helpful for that question.
Thanks, Golden. We do have one question that I can answer that we receive frequently. The question is, what happens to available points for domains when the facilities aren't eligible for the measures in the domain? For example, a lot of facilities aren't eligible for the ICH CAPS measure. Do we get these points or do we not get these points? And the answer is, when you're not eligible for either measure or, in this case, a domain, the weight of that domain is just reallocated equally to the remaining domains that your facility is eligible for. So It's not going to penalize your facility. It's just you get no score for that domain and measure, and we reallocate the weights. Okay, we have a question about, Golden, can you tell us how many measures are in the ESRD QIP in payment year 2028 and then in 2029?
Yes. So for payment year 2028, the ESRD QIP will use 15 measures, and for payment year 2029, the ESRD QIP will use 13 measures if the proposals to remove these 3 measures presented today and add 1 new measure as finalized as proposed.
Thank you. And we do have a question about when the technical specifications based on the proposed rule will be released and the ESRD measures manual. And those are going to be released very soon. We're hoping within the next 2 weeks, and we will be sending out an announcement when those are available for you to review and download. But in the meantime, if you have questions about the new measures, you can submit those. And I believe we provided the link to the help desk in the chat. All right, one final question I'm seeing. There is a question that we've received about the KTRV dialysis adequacy measure. Will CMS be considering revisions to this measure to include hemodiafiltration patients in future payment years?
So great question. Very, very good question. So yes, as the use of HDF continues to grow, CMS will monitor its adoption using available EQRS data and review descriptive information to better understand the utilization and inform future measure development and refinement. Let's see, because HDF was only added as a treatment option in EQRS in January 2026, we will remain in the early stages of gathering the data needed to inform potential revisions to the KTRV dialysis adequacy measure.
Okay, thank you, Golden. All right, I'm not seeing many more questions here, and we do need to move on to our preview period presentation. So I would encourage you, if it's a comment about something in the rule, to go ahead and submit that comment to the proposed rule in the Federal Register. And if you have more detailed questions just about measure specifications, you can send those to the help desk and we'll be happy to answer those. All right, so I think we can move on with our preview period presentation. I will now be presenting on the reports and processes for the ESRD QIP payment year 2027 preview period. The payment year 2027 preview period opens on Monday, July 20th, and ends on Thursday, August 20th at 11:59 p.m. Pacific time. Preview reports will be available at the start of the preview period and can be accessed in the QIP application on the EQRS website. We recommend that you confirm your access to EQRS as soon as possible to avoid any delays accessing your reports. During this 30-day preview period, you may submit inquiries, which I will cover in detail in a moment. You will receive responses to your inquiries both during and after the closure of the preview period, and CMS will aim to respond to all questions within 45 days following the end of the preview period, which you can see here on this timeline corresponds to a target date of October 5th. The final performance score reports, or PSRs, and performance score certificates, or PSCs, are scheduled to be available in late 2026. Once the final PSCs are made available, facilities must download, print, and post the English and Spanish versions in a prominent location at the facility. And these certificates must be posted within the first 15 business days of availability and then remain posted throughout the duration of calendar year 2027. Now let's talk about the importance of the preview period. The payment adjustments to your calendar year 2027 outpatient dialysis claims are based entirely on your facility's preview period scores. The preview period is the only window in which corrections can be made to your scores. And once the preview period closes, you may no longer submit inquiries contesting your facility's results. Facilities that do not achieve the minimum TPS of 56 points will receive a payment reduction of up to 2%. For every 10 points below the minimum TPS, facilities will receive an additional 0.5% payment reduction, as is shown on the table on this slide. Now let's review what is new for this year's preview period. We do have a few measure changes for payment year 2027. First, CMS has replaced the comprehensive KT/V dialysis adequacy clinical measure with the KT/V dialysis adequacy measure topic. Under the topic measure, you will receive up to 4 individual KT/V scores, and those are the adult and pediatric hemodialysis and adult and pediatric peritoneal dialysis measures, which are then combined into one topic measure score. You only need to be eligible for one of the 4 individual measures in order to receive a KT/V topic score. CMS has also removed 2 measures from the reporting measure domain, including the NHSN dialysis event reporting measure and the facility commitment to health equity reporting measure. For additional details on these changes, you may refer to the calendar year 2025 and calendar year 2026 ESRD PPS final rules, both of which are available on the Federal Register website, and we've also included links to these on this slide. On this slide, we provide an overview of the ESRD QIP measures for payment year 27, the domains each measure belongs to, and the weight as a % of the total performance score for each domain. We encourage you to review the CMS ESRD Measures Manual to learn more about these measures, including data sources used, numerator, denominator, and measure exclusion details. For payment year 2027, there are 5 domains, including the clinical care domain, care coordination domain, patient and family engagement domain, safety domain, and the reporting measure domain. And the domain weights have not changed from payment year 2026, and we've displayed them here on this slide. Additionally, as in payment year 26, facilities need to be scored for at least 2 of the 5 domains in order to receive a total performance score. So here we're demonstrating the directionality of the clinical measures and their effects on the performance standards in relationship to measure rates. For the KT/V dialysis adequacy measures, IHCH CAPS measure, percentage of prevalent patients waitlisted or PPPW measure, a higher percentage rate indicates better care. In the bottom diagram, we displayed the measures where a lower percentage rate indicates better care. And these measures include the long-term catheter rate, NHSN bloodstream infection measure, standardized transfusion ratio, and the standardized readmission ratio and standardized hospitalization ratio measures. Now let's review the report updates for payment year 2027. First, let's talk about the Preview Performance Score Report, or PSR. The PSR contains your facility's individual measure scores, total performance score, and payment reduction percentage. These are results and scores that are based on data submitted for each eligible payment year 2027 measure. The PSR provides an explanation of how your measure scores are weighted and then how they translate into your total performance score, or TPS. As mentioned earlier, the minimum TPS, which is used to determine the cut point for payment reductions, is 56 for payment year 2027, and this was determined using calendar year 2023 data. Additional information about the PSR is contained in the Guide to the Payment Year 2027 Performance Score Report, which is available on the QualityNet website and eqrs.cms.gov website. I will talk a little more later about how to log into the QIP user interface, but once you have logged into the QIP user interface, or UI, and download your PSR, closely review it for accuracy. Here on this slide is the first page of a sample PSR with fake data. For clinical care measures, including those shown in Table 1 of your PSR, the improvement in performance rates or ratios and improvement in achievement scores will be displayed if your facility was eligible for the measure. The last column in each table shows the measure weight as a percentage of the individual domain weight. If you are not eligible for a measure, you will see a dash in the numerator and denominator cells. No rate will be displayed for the measure rate, and no score will be displayed for the measure score. In this example, the facility was not eligible for 3 of the 4 KT/V measures. The last page of the preview PSR provides a summary of the facility scores, measure weights, and weighted scores, as well as the state and national average scores. Again, if your facility was not eligible for a measure, no score will be displayed under the facility score column. And please note, this is not the same as receiving 0 points for the measure. If your facility receives no score for a measure or set of measures, the weight of those measures are redistributed to the remaining eligible measures. And you can find more details on the reweighting methodology in the measures manual. And we do have a link to the manual on the bottom of the last page of your PSR. Finally, below the table, the minimum total performance score, ECE months if applicable, your TPS, and the payment reduction percentage are displayed. If your facility is not eligible to receive a TPS and payment reduction, no score and no reduction will be displayed. In addition to the preview PSR, authorized users are able to access available patient list reports, or PLRs, which is a list of patients who are included in each of the measure calculations. Additionally, if you are a corporate POC, you may access the Preview Performance Score Summary Report, or PSSR. Report access and the ability to perform certain tasks within the ESRD QIP user interface are based on a user's role, which will be covered later in this presentation. So next we will go over the patient list report, or the PLR. As I mentioned, the PLR contains a list of patients who were included in each of the measure calculations, and for several measures, you will find additional information used to calculate your facility's numerator. And the purpose of this report is to help provide you with a better understanding of which reports and data, or which patients and data were included in the measure calculations, and to help provide a means for you to confirm that the data used in the measure calculations are correct. If the data in the report appear incorrect, please submit an inquiry with specific patient information for clarification. In your inquiry, please identify the patient using the patient ID provided in the report. Next, let's take a look at a sample PLR. As a reminder, any data listed in these screenshots are mock data. Unlike the PSR, this is a spreadsheet. It separates the data into tabs that can be accessed by clicking on the tabs at the bottom of this screen. The first tab provides you with an overview of the report parameters, and this enables you to ensure that you have the correct report by reviewing the facility payment year and the measurement period displayed. As you navigate through each tab of the PLR, you will see that the reports include details such as the patient MBI, patient ID, their first and last name, as well as the MBI history and the measurement period. You will be able to use the information in this report to identify which patients were included in the calculation for each measure. So in this example, we're showing the Adult HD KT/V tab, which in addition to displaying the patients that were included in the denominator, it also provides those counted in the numerator, along with the KT/V lab value that was used to determine the numerator and the date of that KT/V lab. You may filter the measurement period, which is column F in this slide, in order to look at patients included in the measure calculation for either the performance period or the improvement period. And as I mentioned earlier, if you have questions upon review and need to refer to a specific patient within your inquiry, please include the patient ID, which is column B in this slide, or you may also refer to the row number from the spreadsheet in your inquiry. Please do not include the patient name or MBI. And finally, we have the Preview Performance Score Summary Report, or PSSR, which contains the measure performance rates and scores for each facility for the given payment year. It is a summarized view of the measure results for all selected facilities and can be used to view results for multiple facilities. And this report is only available to the corporate point of contacts, CMS, and CMS support users. To help you better understand your PSR, we have published the Guide to the ESRD QIP Performance Score Report for payment year 2027, which is available to download on both eqrs.cms.gov, on the resources page, and on QualityNet. The ESRD QIP User Interface Guide is also available to download, and I will note that there have not been any changes from the prior payment year. This slide provides you with a link to the QualityNet page and a screenshot of what you will see when you navigate to these reports in QualityNet. Click on Download to access the reports from QualityNet. And next, I will cover how to access your reports when you're in the ESRD QIP user interface. Many of you know by now that EQRS users must log into EQRS to view your QIP scores and to submit inquiries. So next, I will cover the QIP roles and the functionality in EQRS, go over how to access the QIP UI, view scores and feedback, view and download reports, and then submit, save, and reply to inquiries. This training will cover the tasks that will be performed by facility and corporate level EQRS QIP user interface users. Please be aware that any data shown as part of today's training are fictitious. Also, CMS periodically makes updates to enhance system performance as well as the user experience. So it's possible that the screenshots you see in today's training are subject to change. So first, let's cover how to access your QIP scores and reports. The first thing you'll need to do, next slide, please. The first thing you'll need to do to access the QIP UI is to complete the Healthcare Quality Information System Account Roles and Profile, better known as HARP, account registration. If you already have a HARP account, you are all set. You do not need to complete the registration process again, since only one HARP account is needed to access the multiple areas within EQRS. For step-by-step instructions on how to establish a HARP account, please follow the links on this slide. So after you have your HARP account, you'll then need to request an ESRD QIP role. You can check your existing access and submit new access requests by visiting the Global App link, which we provided on this slide, and then navigate to Account Management. And you'll see that under your name in the upper right-hand corner of the page. If you already have access to the patient registry and QIP, you will see them listed under My Access with links you can click on to access the application. This slide provides an example of what you will see on the My Access screen in Account Management if you have access to both the patient registry and QIP in EQRS. If the QIP application is not displayed, click on the Request Access box. And once you've clicked Request Access, you need to choose the appropriate organization type. Click on the circle next to the appropriate type. Then select QIP under the application and enter your facility information such as your CCN or facility name. And once your facility name appears in the drop-down box, click on it. Select the role you're requesting and click on Submit Request. It is important to ensure that you are requesting access for the appropriate role in the QIP application. And here we're showing the different QIP UI roles at the facility level and what tasks can be completed based on the role selected and access granted. If you are the facility point of contact or POC, you may view scores, view and submit inquiries, and view and download reports in the QIP UI. And this includes the PSR, PLR, and the PSC. Each facility must have at least one POC, and a POC can serve as a POC for multiple facilities. Another option is the facility viewer role. A facility may have multiple facility viewers, and these individuals can view scores, view inquiries, and download PSRs and PSCs, but are not able to submit inquiries to CMS or download and view the patient list reports. which have sensitive patient information. You may also see the facility security official role, and only select that option if you are the designated person at your organization to manage QIP users and role requests in EQRS for the selected facility. The QIP UI also has corporate level roles called the corporate POC. An organization may have one or multiple corporate POCs. Corporate POC users can view and access materials for all facilities owned by an organization. Individuals within this role can view scores, view and submit organization and facility-specific inquiries to CMS, as well as view and download all reports within their purview. You'll see there is one additional report available at the corporate level, which I mentioned previously, and that's the PSSR. And this report provides results for all facilities within that corporate POC's purview. I'd like to pause for a moment and note that if you wish to select the QIP application, but you were previously signed into the patient registry, you will need to first toggle to the QIP application in order to review your QIP reports and scores. And here we show on the left what you will see in this situation. Next to EQRS, you can see the patient registry is displayed. In order to switch to the QIP application, click on the 9 dots in the upper left-hand corner, highlighted in the red box. After you click on this, you will see a drop-down box with two options, patient registry or QIP, which we show in the figure on the bottom. Select QIP to change over to the QIP application. Under Switch to QIP, you will be prompted to enter your facility CCN or name. Once you enter this information, select Go to QIP in the box below. And again, this step is only necessary if you were previously logged into the patient registry and want to navigate to the QIP application. Now, once you've logged into the QIP application, the QIP user interface will display the scores and feedback screen by default. For those of you who have used the QIP application in previous years, you will notice the screen looks a little different. To access the different pages within the UI, you will need to click on those different options that are now displayed at the top of the screen. If you have a larger monitor, it will look like the top image on this slide. But for those of you who are using a smaller screen, such as a laptop, you may only see the scores option with a down arrow next to it. You will need to click on the down arrow to see the other pages as we're showing in the bottom image on this slide. First, let's cover what's displayed on the scores page. All users with a QIP role can access this page, which provides users with a quick access to a synopsis of your facility's scores. Users can select or search for their facility to find details about their total performance score, as well as a summary of the QIP measures contributing to that total performance score. Users with purview over multiple facilities can view scores and feedback data on this screen for one facility at a time. Users can either select their facilities from a list or by conducting a search. Let's now look at the steps you'll need to access this screen. If you have access to multiple facilities, you can set filters to assist with your search efforts. To filter facilities, enter your facility name or CCN or dialysis organization, and then click Apply Filter. If you wish to set a different filter, you will first need to click Clear Filter to remove all filters and results. The scores and feedback screen displays a list of facilities in the facility level user's purview. In this example, the user only has access to one facility. However, if you do have access to multiple facilities, all CCNs would be displayed in this list, and you may select which facility to view by clicking the radio button next to the individual facility. The search option automatically displays if that user has access to 10 or more facilities. Then after you select your facility, scroll down to the Run section to review the details to ensure that you have selected the correct report. During the preview period, you will see the preview run under Run Type. And then in this last column, the run date is listed. And you will want to select the most recent run to review any changes that may have been applied to your facility score. Then next, scroll down to the scores details section for an overview of your preview results. Here you will find your facility's total performance score, payment reduction percentage, and additional facility details, including network, state, facility certification date, and services provided by the facility, as is reported in EQRS. When you scroll down to the measure summary section, you will find a summary of the measure scores. And this is just an example of a prior payment year. Once the preview scores are released, you will see all scores for the payment year 2027 measures. Next, I'd like to show how corporate POCs will use this screen. Corporate POCs view the same summary information as the facility POC. The only difference is that the filter facility section is automatically expanded and requires an entry in order to display facilities for the user. And here we show an example of filtering all facilities in Network 7. Once you apply the filter, the table below will display the facilities based on your filter criteria. So to recap, the scores and feedback screen in the QIP UI provides a summary of the facility's total performance score and the measures that contribute to that score. To access the scores screen, you first need to log in EQRS, click View Access under the QIP application, and then select your facility. Remember, all users with a QIP role can access this screen. Next, let's talk about how to access and review your reports. The Reports screen allows you to view and download your reports. Please note that the PSC is not available during the preview period, but will be available during the final period towards the end of this year. All users with a QIP role can access the Reports screen, but these reports are viewable based on the EQRS user role and availability. If you do not have access to your facilities report in the QIP UI, please contact the CCSQ Service Center using the link provided on this slide. The next few slides provide description of the reports that are available for download. Please carefully review these reports, and if you have questions, you may submit an inquiry beginning on July 20th through August 20th. Please provide as much detail as possible regarding your questions, even including the table number if referring to the PSR, or patient ID and measurement period if referring to the PLR. As mentioned earlier, the PSSR is available for corporate level users and includes information that is also displayed in the PSR. If you're a corporate user and have questions about facilities displayed on your PSSR, please submit either an inquiry or a help desk ticket through the CCSQ Service Center. The PSC displays the facility's total performance score. Facilities are required to post the PSC in a prominent location within 15 days of the PSC's release. And remember, this is not released until the final period, which is typically in late fall, and there will be an announcement when that is ready to download. Now let's look at how to view and download reports as a facility point of contact or POC. After you log into EQRS, navigate to the QIP application. And once that screen refreshes and displays the QIP UI, click on Reports at the top of your screen. Once the View Download Report screen displays, you may enter your CCN or facility name and select either the PSR or PLR and then apply Filter. Please note that if your facility was eligible in earlier payment years, you may also select an earlier payment year and download prior year's reports, but the system will default to the current payment year and period. Remember, if you have access to multiple facilities in the QIP UI, you may need to use the search option. And when using the search option, enter the search criteria and select payment year and the name of the report you'd like to generate, and then click Apply Filter. Now navigate to the Select Available Reports section on this screen. And here you'll see a list of available reports for the payment year that you selected. Click the hyperlink next to the desired report to download an individual report as shown on this slide. Downloaded reports will display at the top of your internet browser. Here we show an example of what you will see when you download a PSR. You can click on the report to open or save the file. We recommend accessing EQRS using Google Chrome for optimal performance. If you are unable to download your report, please contact the CCSQ Service Center regarding this technical issue. After you've downloaded your report, closely review it for accuracy and to understand the measures that are contributing to your facility's performance. Here we're showing a first page of a sample PSR with fake data. And then corporate POCs will follow similar steps as the facility POCs when viewing scores and downloading reports. For corporate POCs, the select your facility and payment year section is automatically expanded, requiring the user to search for facilities. And corporate level users do have the option to conduct a single facility level search or an organizational level search. Selecting an organizational level search will result in displaying reports for multiple facilities. So on this next screen, you'll see two search options for corporate POCs. The image to the left shows a single facility search. Enter the facility name and payment year to do the search. And then the image to the right shows a corporate POC performing an organizational level search. Corporate POCs can check this is an organizational level search at the top of the screen. And once this checkbox is selected, additional fields will appear, including search fields for network and state. To recap, the View Download Report screen can be accessed by all users with a QIP role, but reports are displayed based on the user's role and availability. To access reports, log in to EQRS, navigate to the QIP application, and click on Reports at the top of the screen. Next, select your facility and the desired report to initiate the download process. Now let's discuss how to submit and review an inquiry during the 30-day preview period. To navigate to the inquiry screen, select Inquiries that will appear at the top of the QIP homepage. Users can only submit inquiries during this 30-day preview period, but there is no limit to the number of inquiries you may submit, and you may also reply to an inquiry once it has been submitted. Inquiries can be submitted by facility and corporate POCs, but other QIP users can view submitted inquiries to help provide additional support if needed. Here's a quick breakdown of a few roles. Facility POCs and viewers can view submitted inquiries within their purview or scope. Corporate level users can view inquiries submitted for all facilities within their organization. Network level users can view inquiries for all facilities within their network. And additionally, the ESRD QIP UI presents POCs with the ability to draft and save inquiries, but the information entered in a saved inquiry is only viewable by the person who saved that information. If you submit an inquiry, you will receive an email notification once that inquiry has been updated. However, we do encourage you to check on the inquiry status in the QIP UI in case you are not receiving these emails. We'll show you how to submit an inquiry in the system in just a moment, but the screen is a form-like interface that includes a from field, which is automatically populated from the email address associated with the user's account. There's also a CC field to allow the user to inform another person of the inquiry. And then we have a subject line, a message section, and a file attachment option. Additionally, the system will allow you to reply to an existing inquiry if you need to reply to a question from CMS or you have a follow-up question regarding the response you received from CMS. Please note the ability to submit new inquiries will be disabled once that preview period end date hits, which is the August 20th, 2026. You can have follow-up conversations after the close of the preview period. You just can't create new inquiries. It is important to submit inquiries as soon as possible. This will allow time for any necessary communication to take place. And when submitting these inquiries, please include as much information as possible, including evidence to support your case if you are disputing a measure score or data used in the calculation. If you are submitting on behalf of an organization, please include the CCNs of the facilities that you believe are impacted by the issue. You can include attachments to further support your inquiry, but please be careful to avoid attaching PHI or PII. Also, if you have specific questions about your NHSN data, you may direct them to the NHSN Help Desk, and we have provided their contact information on this slide. To begin submitting an inquiry, navigate to the inquiry screen. Then click the Preview Period Inquiries link. Click on the Create New Inquiry box shown here to begin the process of submitting your inquiry. The message portion of the QIP UI displays like an email. When you would like to submit an inquiry, select the facility for which you are submitting the inquiry, and then review the From field to ensure the correct email address is populated. Remember, this field is pre-populated and cannot be changed. So if incorrect information is displayed, please contact the CCSQ Help Desk. The CC field is optional and the subject line is not mandatory, but it is recommended. Again, please be careful with the subject line to not enter any PHI or PII. The message field is required and can accept up to 25,000 characters in the message box. When creating an inquiry, you can upload an attachment to provide any supporting information, and the accepted file types are listed in the UI, and the system can accept up to 10 megabytes per message. Please carefully review your document before attaching to ensure PHI or PII are not included. If you are not ready to submit, you can also save a draft of the inquiry. For a saved inquiry, follow the same steps to create an inquiry. However, instead of clicking the send button, you'll click Save as Draft, and then you can return to that later and submit your inquiry when you are ready. After typing your message and uploading any needed attachments, click the Send Inquiry button at the bottom of the screen. Once a reply is sent, the system refreshes and displays a message that it was sent successfully. We recommend that POCs continue to monitor the status of a submitted inquiry until the inquiry is closed. However, as I mentioned, you will also receive email notifications when updates to your inquiry have been made. The example on the screen shows an inquiry that was sent and had follow-up responses from CMS and the facility, and these are sorted in the order sent with the most recent at top. And you may click on the down arrow to review these messages. The system allows you to filter inquiries and provide several filtering options. You may filter by the inquiry ID number, subject, status, or apply a date range. And here we're showing examples of two of these options. On the left, we show how you can enter a start and end date, that the inquiry was submitted or updated. The example on the left-hand side of this slide will give all inquiries submitted or updated from July 15th through the 31st. Then on the right-hand side, we filter by inquiry status. This is requesting that the system provide the users with all inquiries that have been submitted by the facility with the status of waiting on facility. Now let's talk more about the inquiry status filter option. We have 4 different options for filtering by inquiry status. You may select draft to see any inquiries you have saved but not submitted. If you select waiting on CMS, the system will filter on all inquiries that you have submitted or sent a follow-up response and are now waiting for CMS to either respond or close the ticket. If you select waiting on facility, this indicates CMS has responded to the inquiry and is either waiting to see if you have any follow-up questions or CMS has requested more information. Generally, in this scenario, CMS will wait up to 1 week before closing out the ticket. And finally, you may filter on all tickets that have been closed by CMS. It is good practice to check the UI frequently, particularly for those tickets with the status of waiting on facility, to check and see if CMS is requesting more information regarding your inquiry. Then once you apply your filter, you will see a table of the filtered results. As shown here on this slide, you will see a system-generated inquiry ID in the first column. The inquiry list includes the facility name and CCN, subject line, date created, and status of inquiry. And you can sort by any of these columns by clicking on the arrows in the column header. And for corporate level users, the steps to access inquiries are the same as all other users. You can filter inquiries, and that section is automatically expanded. And this screenshot shows the subtle differences in the previously submitted inquiry section when comparing facility level POCs and corporate POCs. The information displayed in the screen are the same, except that two of the columns have different headers, as shown here on this slide. Similar to the facility POCs, corporate POCs can start the inquiry process by clicking Create New Inquiry. The ESRD QIP UI provides corporate users with the ability to indicate if they are submitting a facility level inquiry or an organizational level inquiry. If you are submitting an inquiry for a facility, do not click the box that says this is an organizational level inquiry. Instead, please use the facility selection search option to find your facility. Follow the same steps as a facility POC to indicate who the message is from, the subject, the message itself, and include any necessary attachments. If a corporate POC believes that the inquiry will affect the entire organization, they should select the checkbox that says this is an organizational level inquiry. And once you check that box, the facility selection option will disappear, and the inquiry can then be submitted for the organization as opposed to a specific facility. The steps to save as well as attach files are the same as what we covered in the facility POC section. Additionally, the steps to search for and reply to inquiries are the same. The only difference is that a corporate POC can select facility level inquiries and organizational level inquiries, which uses the organization name instead of the facility name. To summarize the preview period inquiry process, POCs may submit and reply to as many inquiries as necessary during the preview period. To submit an inquiry, log into EQRS, select the QIP application, and then navigate to the inquiry screen. Once you're in the inquiry screen, click Create New Inquiry. You must have a role of facility POC or corporate POC to submit inquiries. Once you have submitted the inquiries, they are viewable in the UI. If you are having any issues accessing your reports or the QIP UI or accessing the inquiry screen, please contact the CCSQ Service Center by phone, email, or using the CCSQ Support Central link displayed on this slide. In this next section, we will cover all of the key follow-up activities and responsibilities that you will need to know about for this preview period. Following the close of the preview period, CMS will review any outstanding inquiries. The final performance score reports and the performance score certificates are scheduled to be available in late 2026. We will be sending out a notification prior to the release of the final reports. Final facility performance scores will also be made publicly available on the CMS Care Compare website in early 2027. Then once the performance score certificates are made available, facilities must download, print, and post both the English and Spanish versions in a prominent location at your facility. The certificates must be posted within the first 15 business days of their availability and remain posted throughout the duration of 2027. CMS encourages facility staff to review the certificate and facility performance in order to ensure that they can answer any questions that patients may have. Again, the certificate must be posted in a visible and prominent location of the dialysis facility where it is able to be viewed by patients and staff. Now let's recap some of the key responsibilities and activities to ensure a smooth preview period. The payment year 2027 preview period will begin on Monday, July 20th. And CMS encourages facility point of contacts to establish HARP accounts and update your EQRS role to access the ESRD QIP user interface. As a reminder, all preview period inquiries must be submitted before the end of the preview period, which is scheduled to end on August 20th at 11:59 Pacific time, or if you're located on the East Coast, that would be August 21st at 2:59 a.m. Eastern time. Then in late 2026, facilities must download, print, and post the performance score certificates within 15 days of their availability. And lastly, we recommend that you educate your staff about the ESRD QIP so they can answer patient questions about this publicly posted certificate. Next, I will go over the EQRS and NHSN, or National Healthcare Safety Network, data submission deadlines for calendar year 2026. Here we're showing all of the different deadlines that we will be covering in the next several slides. We just completed reporting for the April 2026 EQRS clinical month, which closed on June 30th. The May 2026 reporting month is closing on August 3rd at 11:59 Pacific time. And I would like to reiterate that once these clinical months close in EQRS, you are no longer able to submit data for those months. Then next we have the clinical depression screening and follow-up assessments for calendar year 2026. Facilities can submit these screening results up until March 1st, 2027 at 11:59 Pacific time. If you are submitting your screening results in the EQRS QIP UI, the EQRS patient registry in the UI, please confirm that you are submitting screening results for the correct assessment period. There are times during the year where you can report for multiple years, so please check the year you are reporting for. Next, we have the ICH CAPS attestations for payment year 2028, and these are due by March 1st, 2027 at 11:59 p.m. Pacific time. Just as a reminder, facilities that treat fewer than 30 eligible patients during the eligibility period still must submit an attestation if they do not wish to receive an ICH CAPS score. Next slide. You will find all of the reporting deadlines on eqrs.cms.gov, and we have provided a link to these deadlines on this slide. And we've also included other links, including useful documents such as the ESRD QIP Successful Reporting Guide and the EQRS Data Management Guidelines. On this slide, we're displaying the NHSN reporting deadlines for calendar year 2026. The quarter one deadline was June 30th, 2026. So now we're reporting for quarter two, and that includes reporting for April through June, and that is due by September 30th. Please note that while the NHSN system will accept late data, any data reported after the deadlines or not according to NHSN system requirements cannot be used in the ESRD QIP NHSN measure calculations. On this next slide, we're just showing where you can find these deadlines and then how to contact the NHSN help desk. Thank you. Oh, and we have a few additional resources. And again, these slides are available on eqrs.cms.gov, so you can go ahead and download those. The recording will be available shortly too.